Hello. Today we are going to start learning about the different medications that we use on the ambulance. Each week you will be given a list of a few medications that you will learn and be tested on the following week. There are 27 weeks of these exams that will come up periodically through class. We will be learning about these medications all the time through class, but we have to start somewhere with learning the basic concepts of pharmacology. Some of these concepts might be a little bit over your head to begin with. There is some big terminology that you might not be familiar with yet, but as we go through class, these concepts will become familiar to you and it will make sense at some point during class. This first class, this first drug exam is over analgesics. These are pain medications that we will give to patients that are on or in some type of pain. And we're going to cover drug exam number 1. The first medication we're going to talk about is Toradol. Toradol is a NSAID medication that we give for patients with pain. The nice thing about it is not a narcotic. It does not cause sedation. It is not addictive. Those are some positive things for Toradol. Toradol can be given either IM, intramuscular, or IV. The dose for IM is 30 to 60 milligrams, and the IV dose is 15 to 30 milligrams. One important thing to note is that you should not give this to patients with head injuries, and it can cause exacerbation of asthma. So we want to be careful with that. And also patients with bleeding disorders or known renal failure. Toradol is a nice option before you get into the stronger medications that we're going to talk about next. The next one we're going to talk about is Mepridine. Mepridine is more known as Demerol. It's an older drug that is a narcotic. It is an opiate, Schedule II medication. And it is a good medication for analgesia for moderate to severe pain. It's not carried as much anymore as what it used to be. One nice thing about it is it can be given IM. The dose for IM Demerol is 50 to 100 milligrams IM. It is 25 to 50 IV, and then the pediatric dose is 1 to 2 milligrams per kilogram. It has a pretty short onset and has a pretty long duration. That's one of the nice things about it. It can cause seizures. It can cause central nervous system depression. So we have to watch out for respiratory depression and those types of things. The next medication we're going to talk about is ketamine. Ketamine is the kind of the wonder kid of pain medications right now in EMS. A lot of agencies are giving it for a lot of different things. They're giving it for sedation. They're giving it for pain management. In these drug exams, we will talk about the specific use for a medication in that specific week. So when we talk about managing airways and the use of medication for that, we will talk about ketamine again. But today, in this lecture, we're just going to talk about ketamine as a pain medication. It has a strong dissociative effect, meaning that the person will feel separated from their body. The bad thing about that is that's kind of why it's a very favored drug amongst drug abusers because of the way it makes you feel. It's usually given for pain management and states of excited delirium, which we'll talk about later in class. The dose is usually 1 to 2 milligrams per kilogram over 1 to 2 minutes. It has a very quick onset and it has a fairly short duration. We have to be careful about it though, because it can cause respiratory depression as well. Fentanyl. Fentanyl is the drug that a lot of people are scared of. We see lots of people have hesitation when we go to give them fentanyl for their pain because of all the things they hear in the news. It is another opioid. It is a powerful analgesic. And the nice thing about it is that it does not cause the blood pressure to drop as much as some other medications such as morphine. Morphine, you have to be very careful when you have someone who has a soft blood pressure because it will lower the blood pressure somewhat. Normally, the dosage of fentanyl is anywhere between 50 and 100 micrograms IV given over 1 to 2 minutes, and that you can repeat that dose as well. The duration is about 30 to 60 minutes, so it has a pretty good duration. It does not have as quick an onset as morphine, and that's why some people prefer morphine, because morphine comes on much quicker. It can cause central nervous system depression, so we have to watch for respiratory depression. And a reversal agent for this medication would be Narcan. Any of your opiate medications that we give, they can be reversed with the use of Narcan. The next medication we're going to talk about is Dilaudid, or hydromorphone. Hydromorphone is not given a lot in the ambulance. Usually it's more of an ER medication. It's given a lot in the ER, and it's for acute and severe pain. Again, it is a synthetic opioid analgesic, meaning that it can be reversed with Narcan. One of the things we have to be careful with, it is central nervous depression. It can cause hyperventilation and hypotension as well. So we have to be careful with it. Typically the dose of it is 0.015 milligrams per kilogram, IM, IV, or IO, with a max dose of 2 milligrams. It is known to be 5 to 7 times more potent than morphine, so it is a very powerful analgesic. The next medication we're going to talk about is morphine sulfate. Morphine is an older medication that most ambulance services will carry, not all. There are virtually no ambulance services that will carry this whole list of medications that we've talked about in exam 1. Usually to be 1, 2, or 3 of these medications, not all of them. Because a lot of them do the exact same thing. The nice thing about morphine is that it has a very quick onset and has a decent, good duration. Fentanyl takes a little bit longer to get into the system, where morphine is much quicker. Typically, the dose for an adult is 2 to 4 milligrams IV given over a couple minutes. And one of the bad things about morphine is that if you have a patient that has a soft blood pressure, you're probably not going to be able to use morphine because it can cause hypotension. It can also cause respiratory depression, so we have to be careful with it in that aspect as well. And it can be reversed with Narcan. The last medication we're going to talk about is nitrous oxide. There's no agencies that I'm familiar with in our area that carries nitrous oxide. It is a gas that is given via a mask, similar to what like oxygen is given through a non-rebreather. Um, it's better known as laughing gas. You might have been given it in your local dentist's office. Typically, it is given over a few minutes where the patient is instructed to inhale, and it will affect the patient over the course of a couple minutes. The nice thing about it is that it has a pretty quick onset of a minute or two, but it has a duration of only a couple minutes as well. So if the patient takes the mask off, within just a couple minutes, they're going to start to come back around because the medication has worn off. Dosages go, it's really not something that where we're going to give an exact amount. That's one of the downfalls of it is you really don't know how much the patient is getting, but they inhale until basically their hand drops. So this has been the first week of the medication review. I'm hoping that this will help you get a better understanding of the medications that we are going to learn about each week. And if you have any questions about anything we've talked about in this or anything else, please say something to me in class. We'll see you next time.